Coming to Queen Square, if you're a patient, you know that this is the home of neurology. We've been a hospital here for over 150 years, and we're probably the largest concentration of neurologists pretty much anywhere.
There is an enormous breadth and depth of neurological and neurosurgical facilities here. We have state-of-the-art technology, we have consultants who are at the top of their game, and we also have a very good infrastructure in terms of laboratory support.
It's a place where people look up to, clinicians look up to, our colleagues look up to, and it's up to us to maintain those very high standards.
Whilst we're a separate organisation, we're still under the umbrella of UCLH Trust. So you do have the ethos and the policies and procedures of the NHS protecting you. And we're a professional organisation and we've been around for 30 years.
Well, London has a reputation for medical care which goes way back. I think that the point about Queen Square is that it actually has an international reputation for neurology. Mainly because, we were one of the first 2 neurological centres in the world. We specialised in taking the field forward. We've got a fantastic background in research and clinical care and a reputation for that.
The patient just arrives in Queen Square and can have everything done. You don't have to go across town to have certain other procedures. We can take care of the patient just in one place, and I think that is the beauty of it.
So we have not just a huge breadth of experience, but a depth of experience.
The days are gone when doctors worked on their own, so having extremely good staff working with you is a help. In fact, I don't think you can do things without them. So you've mentioned the nurses who are all very good. I think we also have extremely good staff in the rooms. And of course the secretarial staff are very good too. So as a unit it's tip-top.
So I think in terms of location, for us to be able to say, you're here now, we will take care of you, and we can have everything done on the same day, in the one square, that is a huge benefit to them. They've got enough to worry about.
I mean, having an MRI scan around the corner means that, particularly if we're worried, if either the patient is very worried or we're very worried, we can usually get a scan on the same day. And because the scan archiving system is linked to the hospital, we can view those scans even before they've been printed on a CD.
What that means is I will see patients with the scan done at the Queen Square Imaging Centre and make a plan with them there and then. It's not just going to the local MRI emporium, it's really a combination of the correct scan, high quality reporting, and then liaising with the clinician.
The company's been running for 30 years and we're owned by UCLH Charity, and what we're able to do, as you say, is give the profits back to the charity. Now the charity then uses that for the direct benefit of NHS patients. It is a unique organisation. I certainly have never heard of any other organisation able to do this. It's a wonderful model and it's a huge benefit to the NHS. Our gift aid dividend has not only upgraded operating theatres, we have paid for wards to be created, we have introduced new services into the National Hospital, all based on the gift aid that we've been able to provide, and that's a good feeling.
I'm very, very pleased that the money that Queen Square Enterprises makes in the private work is ploughed back into the NHS. I think that this is a fantastic example of a private-public partnership.
Having pride in your work is it's almost a fundamental view which you have to have as a clinician, I think. Pride in your work, pride in doing a good job for your patients.
I have to say that not only is it the history of the place and the reputation of the place, but the fact that my colleagues are such good people. We have very, very good working relationships. We have real expertise and there's a really can-do approach about this place.
To put it into context, I now do all my private work in Queen Square because I'm very proud of working here, and I think I want my private practice to benefit my NHS patients as well as my private patients.